Good morning. Dr. Michael Wojtanowski of the Ohio Clinic for Aesthetic and Plastic Surgery in Cleveland, Ohio. We're going to talk about double chins today, and there are basically three ways to treat double chins. Surgical, which gives a complete correction. Non-surgical, which consists of two modalities, one called cool sculpting, which is a fat freezing technique, and the one we're going to demonstrate today, which is called Kybella. Kybella is an injection process that allows us progressively over multiple injections to diminish the volume of fat in the under chin area, the double chin area. Carrie, who's our patient today, this is how Carrie looked before she had any injections, and you can see the fullness in this area here, and of course on her profile you can see this. This is Carrie's fourth injection, and the injection process, which you will see, is pretty straightforward and easy for her to go through. She does very well with it. There is some bruising and swelling, especially the first 48 hours. Ice will help that, and camouflage makeup can be utilized if there's some visible bruising that you wish to camouflage. So now we're going to have to do the process here. So the first step of the process is to do some marking, which we will do momentarily. And I'm going to step over here. Excuse me. And you might want to go over here. And the marking just allows me to delineate the area into which I'm going to inject the Kybella. So Carrie, how are you today?
Good, how are you?
If you can move that for us. And you can see this is a little red because Carrie's been using a topical anesthetic technique with an ice pack, which really helps anesthetize the skin to make it a more comfortable process. And what I'm going to do here is I'm going to mark out with my little pen here the area where the fat is pooled and the area that we're going to treat with the Kybella process. It's important that this is done by a board-certified plastic surgeon who knows the anatomy of this area, both inside and out. Surgeons have extensive training about anatomy, and so when someone is having a non-surgical process, it's very helpful to have this performed by someone who knows the inside anatomy, which a surgeon does. What this does here, I'm putting a little water on this little grid, and what this does here is it outlines the areas where we're going to inject the Kybella. You can see the little dots that are showing through. Take this off, you will see some dots on the inside as well. And we will reinforce this area with some more marking. There we go. So that's done. And now the next thing we're going to do is we're going to do the injection process. And we inject with a very tiny, tiny little needle. And that tiny little needle allows us to inject a very small amount of Kybella with each injection. And we're going to do that. We're going to start right here in the middle. And usually this is not uncomfortable at all, or minimally uncomfortable. And you can see this is a clear liquid substance that we're injecting. Kybella is the trade name for this product, which is a product that melts fat when it comes in contact with the fat itself. Now, it doesn't happen immediately because the product has to metabolize. And as the product metabolizes over the next few weeks, the fat that into which this is injected will diminish less and less and less. you doing, Carrie? You good?
Good.
She's always good patient when we do this, which makes my job easier. The important thing for patients to realize when they're having any process, whether it's a surgical process or a non-surgical process like this, that it is performed by a board-certified plastic surgeon who has expertise in the anatomy. We are zooming along here. You're doing terrific. And then after I'm done here, we're going to have her take her little ice pack and put it back on there, and that will help minimize the bruising and swelling. It's a natural consequence of this process. Temporary. But that means it's working. Bruising and swelling is a good thing because that way we know that what we want to happen is happening. So we're wiping this all off now. Wiping the marks off here. And the marks just wipe right off. Special surgical markers are meant to be there when we need them, and then when we don't need them, they wash right off. So that is a Kybella injection. Quick, simple, and easy, and we'll follow Carrie along. She has had 4 injections at this point. The amount of injections are dictated by the patient's anatomy. Some people are able to be improved with just 2 injections. More commonly, patients need 4 to 6 injections because it's a progressive melting of the fat. It doesn't all go away all the time. And once the fat melts, the area has to heal by forming some internal scar tissue and so forth. And it's that healing process, melting the fat and then the healing process, that helps draw in the skin so that the contour improves from where it started. How you doing? You okay?
Doing good.
Good patient. Everything went well, and we're done. Thank you.